Hey everyone, we're back here on the Cover Cannabis Project, and I'm Dr. Blake Pearson again, highlighting patient cases that we see every day with respect to cannabinoid based medicines and the benefits with respect to certain diagnoses and the need for coverage. So I'd like to introduce Ken. Welcome, Ken.
Welcome. How you doing?
Good, good. Thank you. Thank you. Thanks for taking the time. Really appreciate it.
No, not a problem. I'm glad to help if it can help people to get better coverage and help people so that they can take the medication and get away from the hard drugs. I'm 100% behind that.
Wonderful. So let's dive into it. And again, we highlight these cases because it's everyday folks who are benefiting and shouldn't have the need to pay out of pocket for a medication that's helping. So why don't we start, Ken, with just telling everybody about the history of your back and some of the symptoms you've been dealing with.
Okay. Well, I started out, I had my first back surgery, and what they did is they opened up the area in the spine to try and get more blood flow, hoping that that would make things better. And it did help a little bit. So they decided to go second operation to do the fusion because I was still in a fair bit of pain. They did the fusion, but the only problem was with the fusion is that I went backwards instead of forward, which meant I had to take more painkillers.
Yeah.
So I got to the point where I was taking heavy dosage of drugs, and they eventually got on to the fentanyl patch because that's how bad the pain was getting.
Yeah.
And that was a nightmare taking that drug. The first day I took it, I wouldn't sleep for a day and a half because I was so hyped up from the drug because it was such a strong drug, especially when you first took it.
Sure.
And then, of course, then there was the issue of keeping it on your arm or whatever so it wouldn't fall off if you went to the water or something or sweat with it.
Yeah.
So then it really started to bother my stomach. So then we went to the hydromorphine, which it was I don't know if it was not as strong as a drug, but it still helped. But I was taking like 4 pills, three milligram pills. I was taking 4 of them every 12 hours, and but that's a lot of pills to take every 12 hours, So I was looking for anything to make things better because it was making me sick to my stomach from the drugs I was taking.
Yeah.
And that's when I finally got to talk about the oils, and then that's when you come in.
Yeah.
And I really enjoyed talking to you. You made a lot of sense to me, and we tried it. And within 4 or 5 months of taking the oils, I was able to cut my medication in half, which is go to 2 pills every 12 hours instead of 4, which was great. And after over a year of taking the oils, I've been able to drop it down to 1 pill every 12 hours.
Yeah. Gosh.
And my system feels a lot better.
Yeah.
By doing that.
Well, you tell a good narrative there about what we who practice cannabinoid medicine try to educate other physicians on, and again, government on, and that's the opiate sparing effect. So what you kind of articulated, potent opiates like fentanyl, like hydromorphone, starting on, and we'll tell everyone it was a balanced oil, so THC, CBD, equal proportions, and over time, you came off the fentanyl, which is great, but then when we got together, able over a year to reduce that hydromorphone to a point now where it's a lot more manageable for you.
Oh, it's different. It's night and day. I mean, even when I had cut it in half, I would have my breakfast at 9 o'clock in the morning, and by 11:30, 11:45, like I had to have lunch. My guts were starting to ache like crazy and stuff like that because I hadn't ate for a couple hours. And
that's what I wanted to touch on was obviously pain's well managed, and that was the main goal. But maybe talk about how the difference of being on higher doses of opiates versus now much lower doses. Like what's the difference other than the pain control?
Yeah, well, I found the biggest thing with the really hard drugs I was taking that I was more irritable. Like even my wife would say to me, like just calm down, relax, and go for a walk or something because I just I don't know, call it hypertension or whatever. I just would get very frustrated because of the drug just seemed like it wasn't me type deal when I was taking them. I'm kind of a very laid back person, and it made me very irritable and, not in the best of friendship or whatever,
Yeah. Yeah.
And then once I got off of that and got onto onto the hydromorphin, it made it better. I felt a lot better and stuff like that, but it was still the daily functions and stuff like that. It was harder on the stomach, and issues like that.
Mhm.
Just more irritable type deal.
Yeah. Any constipation, or did you not have that side
No,
effect?
I was pretty lucky. I didn't have too much of
Good.
that problem there. I was pretty lucky that way.
Yeah. And then when you think about the fentanyl, the hydromorphone, kind of the lack of pain control, but the side effects you're experiencing, moving to a cannabinoid medicine that's helping you in the way it is, kind of a silly question, but I'll ask it. Do you think you should have to pay out of pocket for this when the opiates are covered?
Well, the thing that bothers me is like right now I have just turned 65, but my wife hasn't yet. So we're covered with the regular drugs, hydromorphine and that stuff, but we're not covered with the oils. And yet the oils is doing me more good and getting me off the hydromorphine, which everybody wants to try and get off of the heavy drugs like that. So you think the government would want to help and push it to get on to the CBD oils
Yeah.
compared to the hydromorphin. And I think the myth of people thinking, mostly older people, I'm not just saying that because I'm old, but a lot of people think that, oh, it's a drug, and you're going to get goofy on it and everything and stuff like that, and you're going to get high and all that stuff. And that's not the issue at all with the CBD oil. I
Yeah.
take it, and an hour later, it's not like, well, my system feels better and I don't have the pain as much, but I'm not goofy and stupid and stuff like that because I've taken it.
Yeah. Yeah. Exactly.
It's the
That's a
nice
good
part I
point.
like about, it's not
Um,
hurting my system.
yeah, and it's a big important point for people to know, patients, clinicians. It's the dose, the amount of THC will determine the impairment. So certainly with CBD, you don't have any, but we can use these balanced oils in low doses. Again, you're around 4 or 5 milligrams,
Yes.
which is a big difference between someone, let's say, who's consuming a joint or something on the adult use side, who's consuming hundreds of milligrams. So it's an important point that the dose matters, and oftentimes you don't see any impairment.
No, I don't find any at all. I mean,
Mm.
and of course I've been on drugs for a long time. I had my back surgery 20 some years ago, whatever. So I've been on painkillers for a long time, and I think it actually even helped with the oils on kicking the other drugs. Also, I didn't get that big withdrawal system because he would talk about maybe getting a withdrawal from the other drugs because I've been on them for so long, and
Yeah,
I don't think I really felt any withdrawal systems to tell you the truth because the oils seem to calm
yeah,
that part of it or whatever also, besides the
yeah.
pain.
So another great point that I hadn't thought about, but certainly we do see that. I'm glad you brought it up because I want to highlight that point as well. You can help mitigate some of those withdrawal symptoms, which are often when people are weaning off opiates, it's irritability. So the oils can help with that. Oftentimes, trouble sleeping is a withdrawal symptom. Again, obviously, the oils can help with sleep. And irritability, oftentimes, when weaning opiates, there's increased irritability as you withdraw them. So, being on a CBD or a balanced oil, in addition to helping the pain, tolerating or having minimal side effects compared to the opiates, it's actually a nice aid to help wean down as well to mitigate the side effects of opiate withdrawal.
Yeah, oh, definitely. It definitely helps like with kind of the mellow out stage, I guess, if you want to call it something like that or whatever, but like the biggest thing that's going to hit me now is that my wife's turning 65 here this fall, is that then I'm not going to be covered for any drugs at all.
Yeah, yeah,
So it's going to be a big hardship
yeah,
changing over to that, because once you get to 65, well, then you get your limited income coming in,
yeah.
and I'm going to be spending almost a quarter of my what I got coming in just to buy drugs, so I can stay alive without any pain.
It's outrageous, and especially when you think of the people who are benefiting from cannabinoid medicine are often people over 65, over 50, over 65, issues like chronic pain, issues like sleep, certainly on the dementia side of things as well. So a lot of the people who benefit are older patients who don't have coverage, and that's the point again. So hopefully people are watching, people are listening, and wanted to really thank you, Ken, for sharing those insights
Well,
with us.
you
Really
said
appreciate
about the thing, I just, one other thing I wanted to say, the shuffleboard club I play with, we're probably the youngest people there. Most of them are in their 70s and stuff like that. And I cannot believe the number of them that are doing the CBD oils and stuff like that. I'm
it.
really surprised. I didn't think, because a lot of these older people, a lot of them, the old style of the prim and proper, type
Yeah,
deal and stuff like that.
yeah,
And I can't believe I would say close to a third of them probably are on some kind of an oil of some kind to help them
yeah.
out,
Well,
because they don't want to get into the heavy drugs. They want to stay away from them.
yeah, they don't want to get into that, and like you, they want to enjoy those later years and stay active. And they're seeing, um, with CBD in particular, they're able to do that.
Yeah. I mean, even if they were to pay a percentage of the drugs or something or whatever type deal, I would rather pay a little more and get covered more on the CBD oil as compared to taking the heavy drugs or whatever. I mean, and I realize we're not going to get 100% coverage like that, boom, right off the start, whatever. But some kind of help sure would be a big help.
Yeah, yeah, and again, like there's just so many folks that age that can benefit and leading in a healthy lifestyle. Now they're having less pain. Now they're doing shuffleboard. They're going for walks. They're lowering their risk by being more active for cardiovascular disease, diabetes. So there is a net win, for overall health as well, and I think that's really important.
Yeah, I probably feel better and do more now than I did probably 10, 15 years ago. We're going for a walk almost all the time. We try to do it on a regular basis, go for a walk and stuff like that. Now because of the COVID, you can't do a lot of things, so we try to be active. And like I say, with the shuffleboard, as soon as we turn orange, within 3 days of turning orange, we're playing shuffleboard. I guarantee you that, huh? And I can't
Perfect.
wait.
Well, that's great, and that's a good way to wrap. So thanks a lot, Ken. We really appreciate it.
Yeah, no problem. And if you ever need anything, don't be afraid to get in touch. I'll be more than willing to help.
Okay, thank you.